Alrighty, chapter 21, cardiac glycosides and heart failure. Remember, we're going kind of crossing around with these, so we have your digoxin, no digoxin. Without even looking at the book, digoxin can be toxic, right? And so make sure that digoxin is given in the appropriate amount and at a therapeutic level. As well as with digoxin, we're going to assess the apical heart rate before we give it. And so we want patients to look at the nursing interventions and client education for this drug. Make sure that the patient can monitor their own pulse and be able to report that as well. So let's see what else we have. Monitoring the K levels is important to make sure it's appropriate. And if the heart rate is less than 60 per minute, less than 70 in children, less than 90 in adults, we're going to let the provider know. Many times we as the nurse will hold it until we talk to the provider. Watch for dig toxicity, and then we're going to look for control and absence of cardiac dysrhythmias. Next one, adrenergic agonist, epinephrine, dopamine. Think about those the best. And so we're going to look at those drugs for what they're trying to do in relation to the disease process. So, but with epinephrine, we're increasing the heart rate. And so remember, epinephrine is given for acute allergic hypersensitivity reactions. In this case, we're going to be able to start up the heart again because it treats cardiac arrest. Remember, cardiac arrest means the heart stopped. So in order to make the heart go again, we're going to give epinephrine. Dopamine now works with heart failure and shock, and when you have issues with the kidneys shutting down, it's going to dilate the kidneys and work on myocardial contractility. Now, dobutamine is more for heart failure, and it increases, it works there. So take a look and see how those three work exclusively different. And remember that with all these patients, you're going to have continuous cardiac monitoring. All right. So, using IV pump, etc. Just making sure I don't skip anything. That is Chapter 21 in a nutshell. Chapter 22, I'm going to try to do this since this is short. Anginal pain. Remember, angina is caused by the lack of oxygen supply or hypoxia to the heart muscle itself. And so we're going to try to prevent myocardial ischemia and pain. You remember there's different types of angina, and the one that's relieved by rest and the one that isn't. And so nitroglycerin is a classic drug that patients take at home. Now, what I can tell you without even looking at the book is nitroglycerin tabs are taken sublingually, and they're kept in a vial that is not exposed to the light. And what will your patient do? They'll take 1 dose, 2 dose, 3 dose, 5 minutes apart. After that third dose, if the pain isn't gone, they should call the emergency room, or not call the emergency room, call 911 so they can go to the emergency room. Better choice. So, remember that you as a nurse, if you're giving one of these anti-anginal drugs, and some of them have it in a cream that you place it on the skin and then you put a tape over it, if you were to touch that, one of the side effects that nurses typically get when they're exposed to nitroglycerin is a headache, and it's a screaming headache. And so make sure that that's something that we're going to wear gloves when administering this, so we don't have the side effect that happens. All right, so page 276 has the different routes, and remember, sublingual is fast, translingual spray is there, and so you look at the things that are underneath each one as you go forward. Yep, just making sure there's your unrelieved in 5 minutes. Call 911. As we're looking at evaluating how it worked, we're going to make sure the patient is out of pain. And that's the end of Chapter 22. I will post this video and we will go on to chapter 23, which will be cardiac rhythm.